Hello again, everyone. This is Dr. Dan Bockmann. Today, we are going to talk about pain and how to interpret it. So basically, we've all had pain at some point in our lives. At this point, if you're able to watch this, you've probably, if you're a kid, you've at least fallen and scraped your knee, or you've gotten a bruise, right? Now, there are all different kinds of pains, different qualities, and there's different severities of pain, and there's pain that lasts, and there's pain that's momentary. Now, sometimes it can be hard to interpret what's the best reaction that I should do to this pain. So first of all, it helps to think of pain as a red light on your dashboard. So if you're driving in your car and you see a light come on and it says, you know, there are a bunch of different lights, right? They're all warnings of something not being quite right. So pain is never normal, but it's not automatically a sign that something horrible and catastrophic has happened. So for example, if you bruise your arm, that's painful to poke on, right? If you break your arm, that's also painful, but the severity is very different in the two kinds of injuries. They're both painful. So often I see the tendency, in fact, I think it's our human nature, is to over-worry about the severity of our injury, the severity of our pain, and cut lots of things out of our life that we don't need to cut out, that we're being unnecessarily cautious or worried about our pain and what it might mean. So let's start talking about quality of pain first. So there are many different kinds. There's achy pain, or some people say burning, or it's stiff, or it's shooting pain, or feels electrical. There's a crampy kind of pain, or pinching pain, right? So these are all words that I hear on a daily basis from patients, and I sense that people want to know what the particular type of pain means, when in fact, the quality of the pain, which is all these things we just talked about, is almost irrelevant. It doesn't matter whether it's pinching, or yesterday was pinching, but today it feels more dull. What does that mean, doc? No, don't stress over that. There are plenty of other things to worry about in life. That is not one of those things. When it comes to pain, literally the only thing I care about is the trend the pain is making over time, and your ability to do things. So is your pain severity, for example, it used to be an 8 out of 10 yesterday, and then today it's a 4 out of 10 at worst, and then a couple days later it's a 2 out of 10. Yes, you have pain every day. I literally don't care if you're in pain. I only care about its trend. If it's trending downward, you're getting well. There's zero risk that you're feeling better, and you're functioning better as time is going by, and yet something is secretly getting worse inside you. So if you see the trend of severity coming down, or the frequency of your pain. So let's say my pain used to be constant last week. It was there all the time, and maybe the intensity went up and down, but I had some pain all the time. And then this week, it's kind of occasional. Maybe I don't have it until the afternoon. That's a trend in the right direction for the frequency of your pain. Duration of the pain. Let's say every time I bend forward to pick up something off the floor, I get some sharp pain somewhere. And it may last for 10 minutes, or maybe it lasts an hour. But by the next week or a couple days later, it's just a brief pain. You know, maybe a few seconds. That's a trend in the right way. So the three things to keep track of for pain, to measure pain and its importance, are the severity of it. How high is it, 0 to 10? How frequent is it? Is it constant, or is it occasional? Is it becoming less common and more rare as days are going by? And the duration of it. How long does it last when it's there? And if you're seeing improvements in any of those three areas, you are getting better. So try not to worry too much. If the quality of your pain changes, ignore that too, as long as the overall trend is going down. By the way, if you're having pain that's not severe and crippling, it's okay to wait up to, my general rules I tell patients, it's okay to wait up to 2 weeks as long as your pain is not steadily increasing over that time and you're not accumulating new symptoms along with that, like weakness or numbness, or you're disabled in some way. As long as it's flat or trailing downward, you can wait up to 2 weeks. If it's rapidly worsening, don't wait. Go get checked out right away. Or if it's starting off immediately severe, get checked out. And especially if you had a trauma, go get checked out for that immediately too. But if it's one of those just little kind of everyday life, a little stiff today and sore, you can wait up to 2 weeks to see if it's going to get better. That's plenty of time for something to show improvement if it's going to. And if it does over that time, yeah, you can wait and see. If after 2 weeks it's still just the same, or maybe it's getting worse, go get checked out. There's going to be no added advantage to waiting 2 or 3 more months, for example. So that just means there's probably something underlying that's causing that pain. That underlying thing is not improving, and therefore the pain is not either. So try not to stress too much about pain. If it's trending better, you're getting better. I hope that's been helpful, or at least informative, and if so, subscribe below. If you have a question you'd like me to answer, leave that in the comment section below. I'd like to get back to you with a personalized video answer for that. See you guys next time.